Hey everybody, it's Dr. Michael Hyland here. I just wanted to bring up a quick topic that I was thinking about as I was driving this afternoon. A lot of people have wondered what the difference is between a traditional neurologist versus a neurologist who's also a movement disorder specialist. And that's a question that comes up often, as well as something that comes up in conversation with clients that I treat as a physical therapist. So I wanted to just spend a couple of minutes telling you about the differences between a neurologist and a neurologist who is also an MDS or movement disorder specialist, and why that matters to you as a person with Parkinson's disease or similar movement disorders. Because remember, an MDS might also work with persons with multiple sclerosis or MS, Progressive Supranuclear Palsy, multiple system atrophy, etc. Many other disorders. Anyway, so the main difference is a neurologist and an MDS, they both are either an MD or a DO, doctor of osteopathy, and they have both gone through the same level of medical school. They've both gone through their fellowship training, as well as that's a 1-year fellowship, and then their residency, which is about 3 years. However, the difference between a neurologist and a movement disorder specialist is that an MDS has gone on to do an additional 1 to 2 years of training beyond the fellowship and residency. And furthermore, what they get in their training that helps with people with Parkinson's is that they will focus on other issues besides just the fact that you have a tremor or you have slow movement and so forth. A movement disorder specialist is going to look more carefully at your medications. They're a better expert in some ways in medication prescription and managing multiple medications, clinically speaking, as well as the fact that they will be focused on the non-motor symptoms of Parkinson's, which tend to get people down more than the movement disorder, actually the movement part of it, because non-motor symptoms include issues with cognition, so memory issues, depression, anxiety, all kind of things like that, and also issues with other organ systems. There's one example is hyperhidrosis or excessive sweating. That can be a symptom some people with Parkinson's have. Then there's constipation, dry eyes, dry mouth, all of those things. They're going to be more focused on those things. Now, that being said, there are some neurologists out there that are not MDS that are excellent. However, if you are having any question about the quality of care that you're getting and in the management of Parkinson's, then you definitely need to look for a movement disorder specialist in your area. Sometimes they're easier to find than others, but by and large, I would think that there would be somebody in your community. Here in the Tulsa, Oklahoma area where I'm located, there are 2. So it really depends on where you are in the country. I'm sure Oklahoma City probably has about the same number, or maybe hopefully more. But anyway, your metropolitan areas should have 1 or 2 or more. But that's it. I just wanted to highlight those differences briefly and to let you know why an MDS is ideally your first choice for a neurologist who deals with Parkinson's disease management over your neurologist who's more of a so-called generalist when it comes to neurological conditions. That's basically like going to see a physical therapist who treats everybody versus somebody who specializes in geriatrics, or somebody like myself who has certifications in Parkinson's disease management like LSVT BIG, or also being an exercise expert in for the aging adult. So things like that. There are more specialized areas to focus on, and that's the main difference between a neurologist and an MDS, is that an MDS is a neurologist, but they specialize in movement disorders, which is, as a person with Parkinson's, that is exactly what you have. So I hope that was helpful. Let me know in the comments below. Be sure to like this video and comment, subscribe, and most definitely, if you want to see more material like this, please consider subscribing to the channel. And as always, be empowered.